Hi everyone, welcome to the first of Co-Create's learning lunches. These learning lunches are basically a space for us to share experiences and ideas from our work in supporting others to involve people. They're half-hour lunchtime sessions, so they're not getting into the nitty-gritty of how we do things. They're more about ideas, different perspectives, things that you can apply to your own work. We'll be sharing the slides and recording after the session, so no need to take notes. Please use the comments to comment on what's going on here, ask questions, connect with each other. The reason that we've chosen to do these on LinkedIn is that the comments stay after the session. And we found when we did things on Zoom, we got so many really interesting comments, questions, things kind of started to come up. And then those conversations ended at the end of the session. So yeah, I really invite you to take the opportunity to keep everything going. So into today's subject, thinking about patient leaders and the usual suspects, who do we need to hear from most? For those of you who aren't familiar with Co-Create, we've been around since 2016. We're a collective of staff and freelance associates with decades of experience between us in involving the public in different ways, and many of us bring our own lived experience to our work. So I'm Danny Sherwood. I lead Co-Create. My background is very broadly mental health and co-production. I started this journey as an expert by experience. I still do some expert by experience work. I've also worked for maybe 4 or 5 years in the NHS. Part of that was about setting up and running a co-production service. And then I've been with Co-Create for 4 or 5 years, supporting others to involve people in different ways. So I'll be bringing all of those different perspectives into today's exploration. And a note on language. So the deliberately chosen these terms, patient leaders and the usual suspects, which are both very value-laden descriptions of people who are regularly involved in involvement, co-production, engagement, those kind of things. There, I think there's kind of important to note, and those are the kind of terms that we hear around. But this session is about systems, and it's about the involvement opportunities we set up. It's not about the people themselves. So there will be times we'll talk about when involving the same people consistently over time is not the ideal approach. But this isn't about saying that those lived experience experts who are doing so much great work out there is not that is not useful. It's just that that model is not always the best approach depending on what we're doing. So we're going to be looking at this in terms of three different kind of angles. One is going to be thinking about people. So this is the who do we need to hear from the most question. How do we kind of decide where we're focusing? Second is about models. So that's thinking about how do we build involvement opportunities? What do they look like? What is appropriate to different types of work? And finally, methods, which is going to be thinking specifically about how we can involve people that we often struggle to involve. So who do we need to hear from the most? In most of the situations where we're doing involvement, co-production, so on, there's more stakeholders than we can speak to. So, maybe we're thinking about a general practice and their patient list. Maybe we're thinking about people across the whole footprint of an integrated care board. So that might be South Yorkshire, for example. Obviously, we can't go out and speak to everyone. We need to choose a smaller number of people, and including those people obviously means excluding others. So that's always a challenge, but what we found can really help is having a clear rationale that we're able to share with people about why we're including some and excluding others. So in terms of the people that we've excluded, it's definitely feedback we've had when we've supported people on different projects that, you know, wherever we focus on a particular group of people who have some challenges, there's always going to be other groups of people who also have important challenges that we can't address. And, you know, sometimes they come and tell us that we feel that we should have involved them as well. And while we can never fix that option because there's too many groups of people who need support for most services to support all of them as well as they could at once, we can make that feel easier by being really clear about why we've chosen to focus in a certain area at a certain point. And it can also be really helpful, and I think this can get missed, to tell the people we want to include really why we want to include them. So I'm going to use as an example quite a bit going through this. I have chronic fatigue syndrome, long-term health condition. Yeah, it feels more comfortable to me often to speak about that example than other people's experiences. So if I'm invited to something, if there's a kind of involvement opportunity that says we want to hear from disabled people, we're doing this thing, with no kind of further explanation of why, it can feel tick boxy maybe. It's kind of sort of leaves a really open question. Whereas if you're able to say we want to hear from people with chronic fatigue syndrome because we're doing this piece of work that we know will affect you, we'd really value involving your experience and so on, that's a more helpful invitation and I'm much more likely to want to take part. So that's why we need to have this rationale, or why it's at least really helpful to have a rationale. So what I'm going to do here is present 3 different possible rationales, and it's going to be kind of a way of working in these learning lunches that it's not about saying there is one way, this is the best. It's about saying here's a set of ways, have a think about what would suit you best. So the first one is thinking about people you've heard less from previously in your involvement. So very straightforwardly, if for example, you've been doing involvement work that's about the whole community, but you've largely heard from retired people in the model you've been using, very clear rationale that this time you need to hear from younger people that we've not heard from before. The second one is about looking internally, so thinking about who is represented already in your organization and also kind of closer partners and networks. So a lot of this is thinking about, you know, who gets to input their needs and priorities in a service. So Co-Create have never done a project about engaging with middle-class white men to find out, you know, what they need, how we can bring them in and so on, because organizations have middle-class white men in powerful positions and we're able to share those things. So this approach is kind of about thinking about bringing people in to fill in some of the gaps in your organization. It's worth noting with that one that makes sense if there is a culture in your organization where people feel sort of safe and encouraged to share their lived experience. Just the fact that someone is there is not the same as they're there and they get to input their needs and so on. So we'll talk about that more in the third learning lunch, which is the end of August, but just to highlight that at this point. And then the third approach, and this is one that we often encourage clients to use, and I'd like to acknowledge Leah, who's attending today, who first introduced me to this. So the curb cut effect is based off the observation that where we have drops in pavements, which allows people with wheelchairs to get on and off more easily, it also benefits many other people. So if you think of getting prams and buggies up and down, or other kinds of mobility issues, people moving luggage around, expanding that out, when we focus on people who have the greatest challenges regarding whatever the thing is that we're focusing on, we often find that it has really good benefits for many other people in the population. So as well as a really important social justice angle about thinking about, you know, who have we generally not been able to include, who's been excluded, let's focus our resources on them. there's also, given our limited resources for engagement in terms of having the most meaningful change from what we do, a really good starting point is thinking about who's going to find this thing the hardest, who has the greatest barriers. So next up, we're going to think about models for involvement opportunities. And specifically, so this refers to these patient leaders' usual suspect categories. Think about, in any given context, how can we think about whether it would be more useful for us to have more of a core group who we keep going back to, they kind of get to know us over time and keep bringing their experience, or whether we need to be focused on diverse people, getting out, meeting lots of different people, not necessarily spending too much time with any group, but meeting as many people as possible. So obviously those two things aren't mutually exclusive. We can run both of those models, but again, just given the context that most of us don't have the budgets or the time to kind of to involve everyone in all the ways that we want, it's good to have a way to prioritize the involvement opportunities that we create. So I'm going to look at this through 3 different lenses. So the first one is thinking about who are the main beneficiaries of the work that you're doing. So who do you want it to really help? In co-production, for those of you who don't spend lots of time around sort of co-production conversations, it's quite a contested field. People often say that's not co-production, this is the version that's really co-production. And one of the differences that I've often seen in there is how people view really the purpose of doing it in terms of who benefits. So if we have a smaller group of people who are involved and then the wider community who the question they're addressing relates to, is our priority that the smaller group of people who are involved have a good experience, get important things out of it? Or is that more a way of supporting the wider community? So again, don't take a view on which of these is better, but they're different approaches to co-production. Now, if you want to really focus on the participants, ongoing involvement has a real value. People get to feel more comfortable over time, far more likely to develop skills and networks and so on. Whereas if you're focused on the wider community, always going to be met with the issue that, if we have a small group, we've got 10 people, maybe it's quite a big group and we've got 20 people, but they're representing thousands, it's always going to be a bit of a poor representation. It can end up feeling very tokenistic. So that's one way to think about this. Second one I'm going to offer is thinking about the population of interest. Who are we really trying to understand and involve in our work? So if we're thinking about a big kind of a diverse population, so again, maybe it's all the people who are registered for a GP practice, maybe it's all the people who live within a region or an area, you've got these huge numbers of people, very different needs and so on. We're going to need to go out and meet lots of different people to do that. Whereas if we're quite specific in what we're doing, so say, for example, you wanted to understand how moving a hospital would affect people with chronic fatigue syndrome who use that hospital. Once we start to get more specific like that, then actually the idea of having a group of people with chronic fatigue syndrome, get 12 of us, some kind of mind to diversity in that group, actually we do start to be able to say something a bit more meaningful about what do people with chronic fatigue syndrome in our area need and so on. So that is another way where we can kind of think about how we target this, which kind of groups we're going to go for. And then finally, we want to think about the purpose of involving people. Why are we here? Why are we doing this? So we do a lot of work in co-create with primary care around supporting people around patient participation groups. So each general practice is meant to have a patient participation group that is drawn from their patient population and their role is to kind of give feedback about the services and kind of bring that patient voice in. What I've seen over time in these groups is that people have very different ideas about why those groups are actually there. There's contractual reasons why they're there, but what are they actually trying to achieve? Some people think it's really about bringing the lived experience to the practice so that the practice can kind of really understand what's happening in the community, what people need, and so on. And other people see it much more as a kind of an oversight role, maybe a critical friend kind of role, a voluntary board, things along those lines. And those things need very different kind of skills and experiences. Excuse me. So if our role as experts by experience or public who are involved, or however you see us, is about sharing our lived experience, that's something that kind of, as long as we have a really safe and supportive environment to do it in, most people can do that. It's accessible to a lot of people. And if that's really what we want, to understand people's lived experience, understanding the lived experience of 10 people out of 10,000 is not as helpful. Whereas if we can kind of go out and start to engage different people in different places, we'll understand a lot more. But if what we want is a role where people kind of really get to know our service, that might really make us want to have people who stay around with us for quite a while. And also, if we want particular skills, so very early on in my expert by experience career, I found myself on a few different boards, and I didn't really know what to do in boards. I hadn't had that experience yet, and I probably wasn't the best person to have there, where there's other people out there with lived experience who have lots of their kind of professional experience that would also be valuable. So that's another way we might want to think about what our model for involvement is. So finally, going to think about methods for involvement. So when people say we don't want to hear from the usual suspects, I guess what it usually means is we wanted to hear from people we haven't heard from before, but it's not been working. So how can we engage with people that we're not engaging so far? There are a lot of answers to this question. I'm going to pick up on one particular one, which is around building trust. So this is partly something that we think about because it comes up a lot as a barrier. This is the reason why a lot of people don't choose to get involved. And it's especially the case where people have been marginalized, have been systematically excluded through their lives. And I think it's important when we go into this, we often encourage people to think about the fact that whether or not someone trusts you or your service when you're going into this is going to go way beyond how you're acting with them and their experience of you as an individual or your service, because people's trust of, maybe it's about public services, maybe it's people with your characteristics, but it's going to come from their whole life experience. So when we find, when people talk about people being hard to reach, sometimes it's just that we need to do a bit more because there's a lot more barriers and it might take a bit longer. If someone has had negative experiences of health services throughout their life, having a single invitation to take part in something, even if it's a brilliant thing and you're paying people and it sounds really important and so on, might well be enough. So we might need that time to build trust with people. Just want to have a quick look at this in terms of building trust. So this is a ladder of participation. You might have come across something like this before. Basic idea is on the white boxes, the doing to side, are areas where people that we involve have very little power or agency. So when we're informing people, we decide what's important and we just go and tell them what we're going to do, what they need to do, and so on. Not that that's always inappropriate, but we're obviously not giving people much power in that situation. When we move to the other side and we're thinking things like co-designing and co-producing, those power differences are reduced and people have a lot more agency. And what I think is particularly important here in terms of building trust is that there's a message in the methods we choose. So it's not just this decision about how we involve people. It's not just a practical decision about what activity we will perform together and what outputs we need from it and so on. It's something that we're telling people about how we value their input. So co-create, we've found that there's a kind of magic point as we move from engaging to co-designing where suddenly the feel is very different. So when we talk about engagement, we're more often talking about the kind of model where we're addressing a challenge, we go out to speak to people, find out what's important to them regarding that challenge, then we take that information back and we use it to inform our decisions in the next step. Whereas when we move through to co-design, we're more coming to people with a problem and saying we really value your input on this. And that just feels totally different. And we often find that it can be quite emotional in sessions. We often hear people saying things like, I've never been involved in something like this before. No one's ever asked me that before. And we could really kind of demonstrate that valuing of people by getting people more involved, and people are also far more likely to come back because, again, with involvement and trust, we're not thinking about one-offs, we're thinking about building relationships, developing. The other part of that we need to be really aware of is that when we do build some trust, someone has chosen to be involved and they've shared something with us, we make sure that we're taking action. So a barrier that we often come across with this is that if you go out, you involve people in some way, you hear things from them, they can be very difficult things you hear, and you really want to make a difference, and you want to be able to come back and say, we've heard this from you, and therefore maybe we've commissioned, maybe we've set up a new service. This is going to meet your needs and make things better. Unfortunately, that's not often the world we live in. So we have the resource limitations again. We also have timescales. So as an individual, if you involve me in something and then don't get back to me for 6 months, I've probably already gone through thinking, oh, that's not really going anywhere, and then probably just forgetting about it. Whereas for an institutional timescale, 6 months might still be early days, and it's kind of going in the right direction, but it's it feels good, but it's very different from those two perspectives. So we encourage you said we're doing kind of a model where the first thing is just remembering to get back to people and saying, we heard this from you. So like we're acknowledging this is what you told us, this was really valuable to us. And then the we're doing is just what's in process, and people are, for the most part, very understanding that things move slowly, and if you are taking action, that feels really important. So we have that message about you said we're doing, as well as sharing with the people who took part, which feels really essential. It's also really valuable to share that with the broader community, with staff, with partners. We want to kind of start to build this idea that if people take part, things happen, things change. And if I've never been involved, never felt like people are listening, and then I start to see, especially if I can start to see that other marginalized groups of people are being listened to, I'm much more likely to kind of take a chance and maybe get involved in the future. And finally, when you are doing this, you want to be thinking about ongoing conversations. So not about kind of dropping in and picking up some information and taking it away, and that's the end of that relationship. But it's kind of, how can people get back to you? So maybe they want to get back to you and say, actually, that's not quite what we said. Maybe they would like an update. Maybe they have some things to offer you this time. So the next step might be not about what your priorities are, but what their priorities are. So this is kind of, there's lots of ways to do this, but I would say the important starting point is that is your aim. And so we're starting to build relationships. And when we see that happen, again, it just feels really magical. Often it's opportunities people haven't had before, really benefits health services when people are kind of, when they have those kind of more direct channels with different kind of community groups. So yeah, I would really encourage you to think about ways you can do that. And please use comments if you've already found ways. So that is the end of today's session. So these are deliberately brief so you can kind of fit it into your busy days. This is the first of 3 of these that we're going to do in August. Second one is going to be about paying participants for involvement. That's on the 15th of August. And the third one is about different ways of bringing lived experience into your organization. So that is 29th of August. And finally, if you would like to get in touch and explore any kind of further support from Co-Create around all things involvement, we offer consultancy, training, facilitation, project work. Connect with me on LinkedIn or email us. Email address is up there. And that is the end of today. Oh, and just to respond to Heidi, yes, these are recorded, so they'll be up on our website soon, and I'll get a message sent out to everyone after this, just with the slides and recordings, if there's anything you want to get back to. So yeah, please continue this conversation, connect with me on LinkedIn, connect with each other, and I look forward to seeing you at the next one. Thank you.